But now we're on the second floor with Robin Hayden. And so you're in charge of the medical assistant program.
Yes, I am.
Okay, so tell me what that is if people don't know.
The medical assistant program, a medical assistant actually is a liaison between the patient and the providers. So what a medical assistant does is basically they will work in outpatient areas, including clinics and sometimes outpatient surgeries. But they're responsible for getting the patient ready for their visit. They do vitals. They draw blood, they can do EKGs, they help with surgical procedures. They also give medications from oral medications all the way up to giving injections.
Okay, so what kind of person excels at this kind of thing? What kind of personality traits do you need?
Attention to detail. We are working with patients, sometimes they're ill patients, and we want to make sure that we do everything correctly. Another good thing to have is for somebody who is able to work with all different types of people, because we are in with a lot of different people and we need to make sure that we can work with them. Being flexible is huge, because not only may you be pulled to another department, but you may have an emergency that comes up and you're going to need to be able to adjust to the fact that that's an emergency and know what to do.
Okay, so once they get done with the program, then they become certified, I'm guessing, and then they're ready to go.
They take a national test. The national test will allow them to work anywhere in the United States.
Okay, so they're not going to have any trouble getting a job once they get done with it.
Currently in Champaign-Urbana, there's over 60 available jobs for certified medical assistants. Nationwide, they are predicting in the next 5-6 years, it'll be a 29% jump in the need for medical assistants.
Okay, and so this is a pretty good living too. I mean, you make pretty decent money.
You make pretty good money, and again, it's dependent on where you live. Of course, the metro areas, you're going to make more money, but then, the cost of living is a little higher.
Sure.
But it is a good starting point for a lot of our students who are maybe just not ready to do the RN program, but they can go from CMA to LPN and then LPN to RN, and it makes it a little easier transition for them.
Okay, so what kind of time commitment are we looking at here to take this class?
The time commitment is 3 semesters. We do a fall, a spring, and a summer semester. The summer semester is basically what they are doing is their clinical hours or their practicum, where they're getting the hands-on experience in a clinical area.
Okay, so if somebody was really interested in this program and they're still in high school and they've got, say, a year left, what kind of classes would you suggest taking to get ready for this?
Parkland College actually offers dual credit classes, and they are allowed to take one class, which is legal issues in healthcare, and the other one is medical terminology, which is a required courses for our certified medical assistant program. So if they could do that, that would be less that they would have to do going in as a freshman.